പ്ലസിലേക്ക് സ്വാഗതം. ഹെൽത്ത് പ്ലസിൽ ഇന്ന് നമ്മോടൊപ്പം ചേരുന്നത് ഷാർജ അൽ സഹ അൽ ഷിഫ ഹോസ്പിറ്റലിലെ ജനറൽ സർജൻ ഡോക്ടർ വിവേക് ശർമ്മയാണ്. ഏവർക്കും സ്വാഗതം.
Namaskaram. Today I am going to talk about some aspect of health which is ignored by all of us. I am going to talk about anorectal diseases. That means, in common language, it means piles, fissures, fistulas and abscesses. Because of the temperatures here in UAE and our dietary habits, these diseases are very common but are not exposed. People don't come out with these diseases because of the nature of the disease as such. People are shy, and by the time the patient reaches us, it is normally at a late stage when the disease is fully developed. So that is why making you all aware of these diseases is part of the training program or of our health conscious details. I would like to stress on these diseases rather than talk about the high-end surgeries of appendix or gallbladder, because these are diseases which we commonly encounter on a day-to-day basis. And these affect every one of us, whether it doesn't depend. What do these diseases include? These diseases include, as I said, piles, which is commonly referred to as hemorrhoids, anal fissures, anal fistulas and abscesses. Now, before I get into the details of this, let me talk about why people have anorectal diseases per se. The incidence is more here. Number one, because of the temperatures. We are living in hot conditions, humid conditions. Number two, our dietary habits are not good. It's a protein-rich, less fiber diet, which actually precipitates these problems. Number three is poor personal hygiene. Because you are working in temperatures which range between 40 and 48 degrees Celsius, the personal hygiene goes for a 6. That means people sweat and they don't care about it because till it becomes a problem. That's how these abscesses, ensure your sebaceous glands get infected and they go deeper and deeper. Another funny thing is that the anorectal region has got a lot of fat tissue. There's a lot of fat tissue, which means there's a lot of scope for the abscess to form and spread to a level where it becomes a real problem. It's not like a normal skin problem. It is an abscess is a huge problem. People don't come to us doctors because of the social stigma attached to it. The people will come to me. I have had patients who've suffered an abscess for about 5 days, tried all their grandma tricks of applying turmeric and this and that, and nothing works. And then they finally come to me when at a very late stage where it becomes an emergency and surgery has to be done. So what are the presentations? What are the clinical symptoms and signs of these diseases? Number one, the patient will complain of perianal discomfort. Number two, patient might complain of bleeding. The bleeding can be clotted blood or fresh blood. Number three, the patient complains of fever, night sweats. This means that the patient has had the abscess or an infected fistula which has been there for some time, for probably more than 10 days. Okay. So number four, and one of the most common symptoms is patient comes to me and says that he has a growth around his perianal region. That means he's got a lump in the perianal region. So now once you know that the symptoms are these, the clinical examination and the proctoscopy, which is compulsory, will help us in diagnosing the disease. Suppose the fistula, if you diagnose a patient with fistula needs to be investigated further in the form of either a fistulogram is done or an MRI of the pelvis region is done. This will show us the entire tract, and thereafter the surgery can be planned. The surgery, what is the surgery you do? You do a fistulectomy. What is a fistulectomy? Fistulectomy is the excision of the entire tract which is infected and which is forming the parallel, kind of a discharge sinus. So that needs to be excised in toto. So that is why an MRI or a fistulogram is compulsory to plan the surgery for a fistula. Coming to treatment. Now, treatment as it is known can be conservative, medical treatment or surgical treatment. I, being a surgeon, will always advise surgery, not blindly, but depending on the patient's symptoms and patient's compliance towards surgery. So the medical management includes, giving laxatives to patients, oral, laxatives with seats bath. What is a seats bath? We advise the patient to sit in warm water for about 10 minutes with some antiseptic lotion like betadine, or you can even normal table salt will work because that works as an antiseptic for that perianal region. Okay, the only way to relax your anal sphincter is by making the patient sit in warm water. There is no medicines available to relax the anal sphincter. So that is why conservative treatment has got its role, limited role, by taking tablets as painkillers, laxatives, sitting in warm water and applying local jelly for the pain relief, and symptomatically patient feels much better. Coming to surgery, hemorrhoids, if it's grade 3 hemorrhoids, the surgery is hemorrhoidectomy, which can be open or close. Then coming to fissures, the surgery is very simple. You do a lateral internal sphincterotomy, which means relaxing the sphincter by physically cutting the fibers. Number 4, when it comes to fistulectomy is the surgery which is indicated, because conservative management of fistula rarely succeeds, because normally the fistula is the average length is about 3 centimeters. So anything beyond 2 centimeters will require surgery. So as far as the treatment is concerned, medical management, if it fails, go for surgery. Surgery provides the most definitive cure in all these diseases, which includes piles, fissures and fistulas.